Hi, I'm Dr. Sylvia Olvera. I'm a neurologist and I have epilepsy. I was diagnosed with epilepsy in 2010, my last year of medical school. I was in the hospital doing a surgery rotation. One of my roommates mentioned that I had a weird episode in the cafeteria at the hospital. She said, "You had a seizure," and I was, "What do you mean I had a seizure?" Then she went on to tell me that I started staring into space, lip smacking, and made a jerky movement of my right hand, and then sort of stared off for a little bit, and then I started talking again. The seizures that I have are complex partial seizures, which are characterized by loss of awareness. So I never lose consciousness. I just sort of don't register what's happening. So when I went into medical school, I wanted to be an OB-GYN. Then the first time my roommate mentioned that I had a seizure and I went to see a neurologist, and she said, "You're in medical school, what do you want to be?" I'm like, OB-GYN. It's like, "Oh, you never know. This might be a life-changing experience for you. You might want to become a neurologist." I looked at her and I said, "I hate neurology. I'll never want to become a neurologist." And here I am. I'm a neurologist now. The worst part that I can say, at least personally for me, it was that it put my life on hold. I had to take time off, deal with epilepsy. That meant couldn't apply for residency, couldn't drive, and I had to move back home, move in with my parents. Just on itself, losing independence is a big issue. I had a surgery because my epilepsy was, at that point, found to be intractable. The surgery stopped the seizures. I no longer seize. However, I continue to take medication. Medication is just to prevent further seizures from happening. Being a pregnant woman with epilepsy, I think it was one of the most stressful moments of having epilepsy, just because I knew that if something happened, I could harm my children. Therefore, I was extra careful in taking my medication. And once they gave me the go, we decided, all right, time to stop birth control, and I ended up having twins. The good thing about epilepsy is that it has taught me to become a better physician. Some of the patients find that reassuring, knowing that someone who actually has epilepsy and has tried some of the medications is treating them. I do not hide the fact that I have epilepsy. In my personal life, to end epilepsy, I'm making sure I continue to take my medications, because for me, my number one priority is to continue to be independent for my children. And as a provider, is helping those patients who are not aware that there's treatment for epilepsy, help them understand it, and get them on a good treatment.